going to proceed with our lesson. So as you see there, this is lesson 10, which is about medical emergencies and first procedures. Okay, so this chapter, just to remind you that it's no longer the anatomy and physiology. This chapter is about healthcare, which comes after lesson 9, which was about nursing skills. Now it's lesson 10. I chose it to deal with medical emergencies, and the second part is the first aid procedures. Okay, now let's start with the first question here. So as a start, which words can come to your mind when it comes to medical emergencies? Did you think of some words, some nouns, verbs, adjectives? Are there any answers? No answers? No answers at all? Dora, for example. I hear no answers at all. Okay. So let's here tell you or show you the words that came to my mind when it comes to medical emergencies. Here I have prepared these words. So let's see there. You have ambulance. You have the stretcher. What's a stretcher? Okay, so the stretcher is it carries victims. It carries victims. It can be with wheels or without wheels. So this is the stretcher that's used to carry the victims. Those who work in the ambulance to use it to carry the victims. Then you have below emergency services. Then you have life-threatening. Of course, medical emergencies are, or mostly of them are life-threatening. They are deadly, so they are deadly. They can cause death. So most of them, not all of them, of course, can cause death. So they are deadly. I can use also the adjective lethal. Okay. Then you have, of course, when there are medical emergencies, so we need a lifesaver. So we talk about life-saving, rescuing, and here below you have the verb rescue. The person is a rescuer. To revive, the same here. To revive, to bring back someone's consciousness, and the person is a reviver. Then you have here the life-saving, and then with the word techniques, you can say life-saving or life-saving techniques. Okay. Okay, so you have, we think also when we talk about medical emergencies, we think of the verb to respond to an emergency. So you always, when there is a medical emergency, you have to respond, how to respond to a medical emergency. You have to think, of course, quick and act very fast. You have to act quick. Okay, so, and when you respond, so you are a responder, you are called a responder. And when you are the first one to respond, so you are the first responder. Okay, and you have here to call for help. Okay, so these are the words I thought of when it comes to medical emergency. Here there is a list of some medical emergencies. So you have the acid burns. So here the chemicals that are at home or in industry. These chemicals can, of course, irritate, for example, the skin. can irritate the skin, can damage the skin, and cause a lot of harm and cause a lot of damage to the skin. So these are the acid burns. Then you have a rabid dog bite. A rabid dog bite. A rabid dog. The dog here is rabid. The rabid here. The dog here is infected with which disease? With which disease?
Rabies.
Good, excellent. Now here, I'm happy to hear your voice. Okay, yeah, nice to hear your voice. Good. Rabies, yeah, rabies. The dog is infected with rabies. Rabies has another name, which is hydrophobia. So hydrophobia or rabies. Hydrophobia is a technical term, and rabies is the common term for this disease. Okay, so it's really dangerous if a child or a person is bitten by a rabid dog. You then have appendicitis. What is appendicitis?
Inflammation.
Sorry? Can you repeat, please?
Inflammation.
Excellent. Of what? Inflammation of the appendix. Right? Okay. So inflammation of the appendix, appendicitis, inflammation of the appendix. Here there is, in this word, there is a suffix. What is it? That the suffix, which means that there is an inflammation. The suffix is
Itis.
Itis. Itis. Yeah. This suffix is itis. It's pronounced itis. Huh? And it can used here in many words of diseases. Okay, like meningitis. Meningitis is inflammation of what?
Meningitis.
Of the meninges. Meninges, okay. And hepatitis is inflammation of what? Think of hepatitis here.
Liver.
Of the liver, excellent. So here, inflammation of the liver is called hepatitis. And there is encephalitis, which is inflammation of the brain. And here you have the appendicitis, which causes a lot of pain. And if the patient is not taken to a hospital immediately and treated by doctors, this will cause, of course, a lot of complications. So it's a medical emergency. The person must be headed to the hospital. Asthma attack. So there is here shortness of breath. Asthma here, the pronunciation is asthma, but it can be pronounced asthma when it comes to American English. Huh? Asthma is American and asthma is British. Bleeding or hemorrhage. Okay, hemorrhage. Breathing cessation. So here, what happens to breathing? Breathing cessation. Stops. Yeah, breathing stops. Okay. Here there is what cessation. Cessation of breathing. Good. Cessation is a noun of which verb? Can you know? The verb cessation. Cease. Yeah, cease. C, it's spelled C, C-E, as in cessation. So always C-E, then A, then S, then E. So here, say breathing ceases, it stops. Here it is really, maybe here it is the most life-threatening emergency. Yeah. So it's a really problem when it comes to, or when breathing cessation occurs, because it is very, very life-threatening. This can cause, of course,
most life-threatening emergency.
Breathing cessation, when it lasts for minutes, it can cause.
His breath is season. Okay.
Heart attack.
Just
a heart attack, but it can cause death. Really, we think of death usually when it lasts, when breathing cessation lasts for, let's say, 10 minutes without medical treatment. This will lead to death within minutes. Then you have the bullet wounds. A wound caused by firing a bullet. The bullet is projected from a revolver, from a firearm, so it is bullet. Okay, so it's a wound caused by caused by a bullet, and diabetic coma, diarrhea, dizziness, or you can use also the noun vertigo, dizziness or vertigo, it's the same. Drowning, a drug overdose, epileptic seizure, epileptic seizure. Here, epileptic seizure. Here, the person say he jerks involuntarily for minutes. Caused by what? This epileptic seizure caused by which disorder? Caused by a disorder. By which disorder? Is it digestive disorder, for example, or respiratory disorder? Epileptic seizure is related to neurological disease. What is it? This is a neurological disorder, neurological nervous disorder. The disease is called epilepsy. Epilepsy causes this epileptic seizure, so the person jerks. His breathing is difficult. The person can fall. Then food poisoning, foreign body in the eye. This also can cause discomfort, fractures or broken bones, gallbladder attacks, kidney stones, obstruction of the windpipe, scorpion stings, sunburn, and unconsciousness. So this is the list of medical emergencies. Now you have other medical emergencies. Here I will introduce these medical emergencies through pictures. Okay, this picture is about which medical emergency? As you see there, it's about frostbite. Good, frostbite. So what's frostbite? So you have to explain. The word is composed of frost and bite. Let's explain frost. What's a frost? As you see there is a frost. There is extreme cold. And here the temperatures falling, or you have your freezing temperatures. Temperatures fall below freezing, so it's freezing. It's very cold. So when you protect yourself against frostbite, what can you do? If you want to protect yourself from frostbite, what do you do? Let's see the prevention. How to prevent yourself. You have to avoid these temperatures. He said you're avoiding moisture, means avoiding humidity. Moisture is the humidity. And you have to wear layering clothing. So with many layers, one on top of the other, okay? You wear a coat, you wear a pullover, you wear socks, you wear gloves, you wear boots, so this is how you prevent yourself against frost. And of course, you can use these warming devices, either at work, in class, or at home. You use warming devices. Okay, so when so frost here means here cold weather. Okay, cold weather. It means also ice crystals. Okay, when someone has no access to heat, has no access to layering clothing, no access to heat, no access to layering clothing, what can he develop? What can happen? Here, let's look at the symptoms there. Can we read there? The person can, for example, lose feeling, or he can be numb. Numb is the same. Numb means you don't, you lose feeling, you lose sensation. So
burn the skin.
Sorry?
Burn his skin.
Yeah, skin burn. Skin burn. Yeah, good. Burning the skin. The skin is burned. Skin burn. But here there is no fire, but there is extreme cold. So here the problem here is called frostbite, but there is no bite at all. There is no bite. Maybe bite means attack, an attack of under frost. Can frostbite cause death? What do you think? Can it cause death?
Yes.
Of course, it can cause death, and every year we hear of children and elderly people dying of frostbite. Okay. The next picture here. So here I wrote frostbite. Frost means ice crystals, so ice and temperatures falling below freezing. Here you have you see here hand affected by frostbite. Okay. There is exposure to temperatures below freezing, which can lead to severe soft tissue damage. So this tissue damage, you see there the bully. The bully is a plural of bulla. Bulla and bully means there are here blisters or bubbles. Okay, and the hand can turn black. Okay, because of this extreme cold and no access to heat, no access to warmth. And the frostbite usually affects the nose, the fingers, and the toes. Okay, next medical emergency. Here, as you see, what do you see there? What is it? It's an aerosol spray. An aerosol spray, and they say that aerosol sprays are usually safe. Okay, but how can they be dangerous? We use them maybe on a daily basis. We use this aerosol sprays on a daily basis, but how can they be dangerous? Do you know how can they be dangerous? Can be dangerous.
Aerosol sprays.
Sorry?
Aerosol sprays are generally safe, but how can they be dangerous?
Can you speak more loudly, please? I'm happy to hear your voice, but I want you to speak more loudly. How is it dangerous? How a nice aerosol spray is dangerous?
When the bottle gets broken.
Yeah, when it gets broken. Good. Yeah. So it mustn't be pierced. Huh? It mustn't be pierced. Good. Nice. Or think of any other danger of the aerosol spray. So when you accidentally spray your
Eyes.
Yeah, or your nose or your mouth, okay, and the content is toxic. For example, you are spraying the garden here, the trees in the garden. I mean the trees in the garden, and instead of spraying the trees, you can direct this content, this poisonous content, towards your eyes. So you can irritate your eyes. You can inhale this content. You can even ingest this content, and this can be harmful. And you know that these also, thirdly, the aerosol sprays are what?
Extremely flammable.
Extremely, can read there.
Flammable.
Flammable, good, extremely flammable. So thirdly, the aerosol sprays are extremely flammable. Flammable, what does it mean, flammable? Can I say inflammable too? They're the same. Inflammable is not the opposite of flammable, so they are synonyms. Flammable and inflammable. The aerosol sprays are inflammable, means they can easily set on fire cause burns. They can cause burns. So here, let's read some words. Can you read here some words there? Can any one of you, please, read some words here? So you have extremely flammable, and you have a pressurized container. You have a protective from, I don't know, and do not expose to temperatures exceeding 50 degrees Celsius. Do not pierce, as you said. Do not pierce. Do not spray on a naked face or any incandescent material, like for example, maybe fire. Don't spray it towards fire. No smoking. Use only. Do not spray towards eyes and okay. Good. So here, as you see there, so they are inflammable or flammable, and they can easily set on fire. Okay, next medical emergency. Okay, what do you see there?
Ankle.
Good, an ankle, a joint, huh? The ankle joint. You have two joints, two ankles, 2 feet. One has the ligaments. Let's focus on the ligaments. The ligaments. Let's focus on the ligaments. The first ankle, the ligament is
Sprain.
Is the first one. I mean, the one on the left. The one on the right. Let's speak about the one on the right. The ligament here is damaged. Good. Here, the ligament is damaged, huh? And the one on the left, the ligament is healthy. It's not damaged. Okay. So here the ligament is damaged, or the ligament is broken. Is broken. You can use the word broken. So not only bones break, not only bones are broken, but even the ligaments. We use the word break. The ligaments are broken, or are ruptured, or are torn. What is torn? Torn here is the past participle of which verb? The ligaments are torn. Tear. Good. To tear like this here. So to tear. Okay. To tear a piece of paper, for example. Okay. Here this medical emergency usually occurs, for example, while playing football, or it occurs when someone twists his ankle. So here, bad twist can cause the ligament to break. Is it life-threatening here? Ligament, is it life-threatening? Is it as life-threatening? No. It's not life-threatening. It's not as life-threatening as breathing cessation, for example. But it here the patient here must consult immediately medical assistance, of course. So what is the problem here? Can you say what's the problem?
It's a sprain.
It's a sprain. Good. It's a sprain. A sprain or sprained ankle. The sprain is an injury that affects the ligaments only. So in mild cases, the ligaments overstretch and are overstretched, but in severe cases, the ligaments break or tear or get broken or get torn. So you have mild cases and severe cases. In mild cases, it just overstretch. In severe cases, they can tear. Sorry. Okay, next problem. Here, so no ligaments here, but the problem is with the
muscles.
With the muscles, because with the muscles, with the bundles of muscle fibers. What can happen to the bundles of muscle fibers? We can use the same words as we use them with the ligaments. Huh? The bundles of muscle fibers can
be torn.
Can get torn. Good, can get torn. So the bundles of muscle fibers can get torn, can get broken, can get ruptured. This is in severe cases, huh? And in mild cases.
Overstretched.
Good. So can use the same word. So in mild cases, but here not the ligaments, but here the muscles, the muscles of the bundles of muscle fibers overstretched. This is in mild cases, and this can happen as a cause of what? the cause of it is the cause of
Overstretching.
overstretching, good. Overstretching, or you can use also the word over-exercising, okay, or over-exertion, over physical exertion, there's exertion. So here, for example, when you walk on a treadmill, as we say in French, tapis roulant. So treadmill, If you walk on a treadmill for over an hour, this can cause the muscles to overstretch. What is the problem here? Is it sprain? It's not sprain here. The problem is not with the ligament. Huh? The problem here is the
Strain.
Strain. Good, excellent. So here it is a muscle strain, or can call it a pulled muscle. It occurs when the muscle is overstretched or torn. This usually occurs as a result of fatigue, overuse, or improper use of a muscle. Strains are most in the lower back, neck, and shoulder, and hamstrings. The ham of the hamstring, and the hamstring is the muscle behind your thigh. Good. What do you see there? You see there the lower back is discolored. The lower back is discolored. It's purple. Huh? It looks purple. It looks blue here. And what caused this discoloration of the skin? What do you think? What caused this discoloration of the skin? Any idea?
By a blow.
Yeah, good. A blow. So here, strong blow. You blow to the body. Blow to the body. So here the person can be hit by a car, can be hit by a chair, by, I don't know, any hard object here.
Okay.
And as a result, the blood vessels break. Blood vessels break or tear. So what is the problem here? We described the problem, but we didn't mention the problem. What is it? Starts with B. B.
Bruise.
Bruise. Good. This is a bruise. Huh? Or you can use what contusion. Huh? I think you have the word in French. Huh? The bruise. It's a bruise. The bruise. Let's describe the bruise. Discolored area on the skin. Here, the blood vessels. The blood vessels have been ruptured or broken or torn, and this is caused by a hard blow to the body. Another medical emergency, as you see there, it's a heart attack. Okay, let's explain what a heart attack is. What happens when there is when a heart attack occurs? The coronary arteries.
Tears.
They can tear. Good. They can tear,
Yeah.
or they can be blocked. They can be obstructed. By what can obstruct here the coronary artery? If you read there, you have
A clot.
A clot. Excellent. A blood clot, or a cholesterol plaque. Cholesterol plaque. So this obstruction will affect the flow of blood to the heart. Okay, so there is no continuous blood supply, so no continuous blood supply to the heart. This will affect, of course, the heart muscle, so there is no oxygenation to the heart muscle, and the heart muscle will die. This is a heart attack. Heart attack is not a technical term. Huh? What is a technical term for heart attack? It's a
stroke.
No, the stroke affects the brain. Let's read there. The word is, I give you the word. It's a myocardial infarction. Good. Myocardial infarction, or MI. This is, which means a heart attack. So here there is interruption of blood supply or blood flow to the heart. Good. So happy to hear your voices. Huh? I want you to participate as much as you can. Next, here in this diagram here, I chose it and I liked it because it differentiates between the cardiac arrest and the heart attack. Huh? There is difference, of course. Huh? It is explained that the cardiac arrest, so there's arrest, so there is a stopping of the heart beating. So it is said it is an electrical problem, while the heart attack is a plumbing problem. Maybe nice words, huh? to make the difference. The heart attack is a plumbing problem. It's a problem with the flow of water, but the flow of blood to the heart. The flow of blood to the heart is obstructed, is impeded, is interrupted, and in the cardiac arrest, so it is said that it occurs when beat. Can you read for me, please? Cardiac arrest occurs when the heart. I don't know. It's not clear for me, really. Okay, sorry. Okay. Next. About now, as you said, the stroke. The stroke, as you see, there is a brain. The stroke always affects the brain. What's a stroke? Can you explain? There are two types of strokes. You have the ischemic and the hemorrhagic. Ischemic and hemorrhagic. What's ischemic? What's ischemic? You can use the same words as we used in the heart attack. Huh? Ischemic stroke. So here, blood vessel within the brain. What happens to the blood vessel within the brain?
Obstruction.
Yeah, it gets obstructed. Good. Blood vessel within the brain gets obstructed, gets blocked, maybe by blood clot or by, I don't know, cholesterol plaque. And the hemorrhagic is from the noun hemorrhage, hemorrhagic. Hemorrhagic, as you said, there is a tear, or a break. You can use the noun a break that occurred to the blood vessel. It's hemorrhagic. This is a stroke. The stroke can also be called brain attack, or a cerebrovascular. I have to correct. Cerebrovascular accident, or CVA. Okay, good. Now, after introducing some medical emergencies, let's now do this exercise. It said, read these paragraphs and identify what the medical emergency is. Please, can you read and identify the problem here? Yusra, for example, can you read? Yusra, can you read, please? Durra, can you read?
A sudden occurrence of coronary thrombosis, typically resulting in the death of part of the heart muscle, and sometimes fatal.
Fatal. Good. What is the problem here?
Heart attack.
It's a heart attack, because of the, as you see the words, coronary thrombosis, coronary thrombosis, which results in the death of the heart muscle. So you see the answer there, it's a heart attack. Next problem. Can you read for us, please? Please to read the paragraph.
Generally regarded as safe when handled according to directions, but they can be directed accidentally toward the face with resulting contamination of the eyes or inhalation of the fumes. The pressurized containers may contain products that are highly flammable, producing burns when used near an open flame. Aerosol sprays.
Good, excellent. Good. So aerosol sprays. Next. Yeah, yes, please. I want to hear your voices.
Wrenching or twisting the ligament of an ankle, wrist, or other joint violently so as to cause pain and swelling, but not dislocation. Sprain.
Yeah, this is a sprain. Huh? Good. Why do you say sprain?
The ligament.
Yeah, because you have the word ligaments. The sprain affects the ligaments. An ankle or a wrist or any other joint wrenches or twists. So this can overstretch or tear the ligament. So this is the answer, as you see, sprain. It's there below. D. Yes, please.
Having severe difficulty in breathing because of constricted or obstructed throat or lack of air. Asthma.
What is the problem here?
Asthma.
I can't hear the answer really.
Asthma attack.
No answer. What is it? Difficulty in breathing?
Choking.
Choking. Good. Choking. So here, there is difficulty in breathing. Okay, it can be caused by any object here embedded in the throat or lodged in the throat. It can be caused by fumes, by smoke. So it is a problem or obstruction of breathing. Choking. Good. The next.
Injury to a muscle caused by overexertion or overstretching. It's a muscle strain.
Good. The next. Are there men here? No men? Yes, please. Umayma, for example. Umayma, Majidi.
It is caused by a disruption of normal blood flow to the brain, either by a rupture of a blood vessel within the brain or by a blockage of an artery supply the brain. The onset may be marked by a variety of manifestations ranging from headache, slurred speech, or blurred vision, sudden collapse, and unconsciousness. It's a stroke.
Good. Here, because there is a disruption of normal blood flow to the brain. Do you have any questions about words here in this paragraph? What is the onset? Onset. The onset of a disease, it means the beginning. Excellent. The start. Excellent. So the onset, the beginning, may be marked by these symptoms, ranging from headache, slurred speech. When it is slurred speech, someone slurs, so he cannot speak clearly. So he slurs, and his vision is blurred, means is unclear. Good. So you see the answer there, it's a stroke. G. Yeah. Umayma, for example. No. No one's. No response. Okay, so injury to body tissues caused by exposure to extreme cold, typically affecting the nose, fingers, or toes, and often resulting in gangrene. This can lead to gangrene, and gangrene is explained below. It is a localized death and decomposition of body tissue.
Frostbite.
It's a frostbite. Good, because you have exposure to extreme cold, and this can affect the nose, the fingers. You saw how the picture above. It shows how the fingers are affected, and you saw how the skin turned black and the bully. It's a frostbite. The final one here, maybe the list is a bit longer. Okay, so it's a temporary unconsciousness or confusion and other symptoms. It is caused by a blow on the head. A blow on the head. Imagine here, blow on the head or to the head, which causes unconsciousness. Maybe you saw the answer. The word is a new one. We haven't seen it throughout this lesson. The word is, you know the word? Can you pronounce it?
Concussion.
Concussion. Yeah, concussion. Concussion usually is a blow to the head that can cause unconsciousness and other symptoms. Okay, nice. Now, maybe it is the same exercise. You will always identify the problem. Here you have call for help. These situations from 1 to 7 or to 8 to 9. Okay, here his body is jerking or twitching involuntarily. The body is jerking, twitching involuntarily. The jerk is explained there. It is a quick, sharp, sudden movement. And this person has fallen, and his breathing can be labored or can be difficult. What is the problem of this patient here?
Epileptic seizure.
Excellent, epileptic seizure. She was submerged in water. Help. She was submerged in water. Help.
Drowning.
Drowning. He overstretched his calf muscle and ruptured it.
Strain.
Strain. Good. He twisted or wrenched his ankle and tore the ligaments holding it in position.
Sprain.
Sprain. A small toy is lodged in his throat and blocked his airway. Choking. He's bitten by a rabid dog. Infection with rabies or hydrophobia. Maybe you forgot the word rabies. He's frozen to death. Frostbite. There is interruption of blood flow to the brain.
Stroke.
Stroke or CVA. A thrombus impeded the blood flow or the blood supply to the heart. T is missing.
Heart attack.
Heart attack. Okay. Heart attack. Good. Or myocardial infarction. Thrombus. What is the plural of thrombus? Thrombi. Excellent. So here you have the answers for you. So you answered well. So good. Okay, now let's give a definition to a medical emergency. What's a medical emergency? Okay, let's complete this definition. A medical emergency is an acute I that poses an immediate risk to a person's L or H. These emergencies require I assistance from either first A, emergency medical technicians, P, and physicians. So a medical emergency is an acute I or I. Think of sprain, of strain. The sprain and the strains, we said that they are injuries. injuries. The other eye, so one eye is referring to injury, and the other eye, think for example of heart attack, or so here, or another eye. Okay, so so here this poses an immediate risk to a person's, so they're life-threatening, life, or each. Think of healthcare. Okay, and these emergencies require assistance. This assistance must be
immediate.
Immediate, yeah, immediate. So no delay, cannot delay responding, So the assistance must be immediate. And this response, immediate response or immediate assistance, can be provided by first
Aid.
Person. First
Aider,
good. First aider. And the first aider can be accredited or non-accredited, okay? Can have a certificate or without a certificate. Anyone can give help, and even a grandmother can give first aid, or can be someone who is accredited. He has a certificate. Maybe who is more qualified than the first aider is the EMT. EMT is short for emergency medical technician. And P, think of P here, who can provide paramedics, good, the paramedics. And who is more qualified, the paramedics or the EMTs? What do you think? The paramedics, the paramedics are more qualified, but both respond or are trained. They have university certificates, and they can respond to medical emergencies. And of course, the most knowledgeable, the most qualified is the physician. Okay, let's see now the answers. Medical emergency is an acute injury or illness that poses an immediate risk to a person's life or health. These emergencies require immediate, and here I added the word prompt, so maybe I want you to learn the word prompt. Prompt assistance means immediate and quick assistance from a first aider, emergency medical technicians, paramedics, and physicians. Good. Now here we came to the second part of the lesson. So in the first part, we introduced a number of medical emergencies, and now we will deal with the first aid procedures or techniques. Okay, so look at the diagrams. Here you have, as usual, diagrams below about some first aid or life-saving techniques or procedures, and say when and why they are used. Okay, the first one here, first diagram. Okay. What do you see there? Do you have any comment on this diagram? You have two pictures, one on the right or on the left. On the left-hand side. On the left-hand side, you see here a rescuer or a first aider doing what? Giving rescuer or first aider giving
back blows.
5 back blows or dorsal blows. Which area do you blow? Which area here is sorry?
Between the omoplates.
Yeah, omoplate here. Which word do we use in English?
Scapula.
Scapulae. Between the scapulae, yeah? Between the two scapulae, or you can also use shoulder blades. Remember this word, shoulder blades. So you blow or you hit, you give blows, 5 5 back blows between the shoulder blades. Okay? Here you are responding to which problem? When you give 5 back blows, you respond to which? To
Choking.
choking. Excellent. Choking. Choking. So what is there here in the throat? What can be in the throat? Any small object, huh? Any small object which is embedded in the throat, in the airway, yeah? Embedded here, embedded. Small object embedded in the throat. Embedded means is fixed there and cannot leave. Is embedded, use embedded. So he has a piece of glass embedded in his thigh. A piece of glass embedded in his thigh. It's embedded. It is lodged there. Okay, so you need to remove it. Okay. And you give these 5 back blows to this choking person in order to do what? Why do you give him 5? Are you punishing him, for example?
To help him breathe.
Yeah, to help him breathe. Good. To help him breathe. Nice. To help him breathe. Yeah, because he has difficulty breathing. His airway is obstructed. Okay, so you give these 5 blows to remove the object. This is what you want to do, to remove the object. So we say you want to clear. You remember this verb? We use it in class many times. Huh? To clear the airway, or to remove the object, or to dislodge. Dislodge. So there is an object lodged. And you dislodge it. Nice. There is another way of dislodging the object, of removing the object, of clearing the airway, which is by giving 5 abdominal thrusts. Here, thrust means you push here. You push, abdominal pushes, abdominal thrusts. Okay, I think we are familiar with this technique. Huh? What do you call it?
Heimlich.
Good. The Heimlich maneuver. Good. This is the Heimlich maneuver. You can, I think you can perform them alternately, yeah? One after the other. Okay, so let's read here the description. So here are some words we used orally, and I left them for you as notes. Okay, for you. So here there is a small object lodged or embedded or fixed in the airway. 5 blows or 5 hits are given to respond to choke in order to dislodge or clear the lodged object. And how to do the Heimlich maneuver. Heimlich maneuver. You have to stand behind the person and wrap your hands around his waist and place your clenched fist just above the person's navel. Clenched fist here. My fist here, you see, and my fist is clenched. Okay, so here, how is this? Yeah, clenched. This is a clenched fist above the person's navel. You know the navel. A navel is what? The belly button, the umbilicus. Then quickly pull inward and upward, as if to lift the person up. And then you perform here. You are performing 5 abdominal thrusts. Okay, and if the blockage is still not dislodged, you have to continue these cycles, and you can alternate the back blows and the abdominal thrusts till the object is cuffed up or is removed. Good. So here we dealt with 2 techniques: the Heimlich maneuver and giving 5 back blows between the shoulder blades to respond to choking. Next diagram, next illustration. Okay, here this diagram is about what? Shows you what? The position of what? Any answers? The position of the head. It's the position of the head. Okay. It is so here the head is placed backward. Okay. And the chin here, this is the chin. Is the chin downward or upward? Downward, okay, or upward?
Upward.
Upward. Okay, so this is the position of the head you choose. Okay, you choose the head to be placed backward. Okay, and the chin, of course, will be lifted, raised upward. Okay, this is called, as you see, head tilt and the chin lift. Head tilt and the chin lift. So the head is tilted. Tilted. So here I will explain with this following diagram the meaning of tilted. So you see here two containers. One is in an upright position and one is in a tilted position. So the head here must be in a tilted position and of course with the chin upward. This is tilted. So here head tilt, just to want you to learn this, head tilt and chin lift. But why do you choose this position? Why do you tilt the head with the chin upward? Why do you choose this head tilt and chin lift positions? Any answers? Okay, so here we say to open the airway. To open the airway. Here I explained the meaning of tilt. So a tilt is a noun here. It can be a verb, but here it's a noun. Tilted position or sloping position. So one end is higher than the other. And lift is a raised position. Okay. Good. Next one, you have another life-saving technique. What would you see there?
CRP.
Yeah, CPR. 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 CPR is the short for what? CPR.
Heart.
Can you?
Heart arrest.
Cardio. Pulmonary. Resuscitation. Resuscitation. Resuscitation means reanimation, but they use the word resuscitation. Cardiopulmonary resuscitation. Okay, and how do you perform, or what is cardiopulmonary resuscitation? CPR? What does it consist in?
Chest compressions.
Excellent. Chest compressions. Okay, so you press the chest. Okay, for which reason? Why do you perform these chest compressions 30 times?
Cardiac arrest.
Yeah, when there is cardiac arrest. Good. So it's a life-saving technique you perform to respond to cardiac arrest here. The heart can stop beating, or there are irregular heartbeats. So you compress the chest 30 times to allow the heart to work again. So let's look at the command. So you have here 30 chest compressions are performed by placing one hand on top of the other. So this is here. This is the top of the hand, and this is the bottom of the hand. So this is the bottom and the top of the hand. So you place the top of one hand on top of the other, and clasping them together. And the CPR, of course, will keep the oxygenated blood flowing to the brain and other organs, of course. And the purpose is to restore the normal heart rhythm. Restore. So it's can you use another verbs of restore? Restore the normal heart rhythm. Restore it. Another verb to replace restore. To restore. Can use regain, to regain, or to bring back, to bring it back. Okay. Nice. This device. What is this device? Yeah. Do you know this device? Are you familiar with this device? This device restores the heart's rhythm. It restores the heart's rhythm. It is called
defibrillator.
Good, excellent. Defibrillator. Yeah. But this defibrillator is usually used outside of the hospital because it is portable. It's a portable one, not the one used in hospitals. It is a portable one, and it is called here, and it is automatic. It works automatically. So you just learn how to use it, and it's okay. So it is called an automated external defibrillator, or AED. AED. So you can have one. With you to respond to cardiac arrest whenever it can happen. It can also be available, for example, in supermarkets, in large supermarkets. It can be available in bus stops. But I don't think it is available in our country. Yeah? But it is available in the rich countries, so they provide it here. They provide it there for the people for fear of unexpected cardiac arrest before the ambulance comes. So here are some words to read about this AED. The AED is a lightweight and portable one. It delivers electric shock to the heart. And of course, to allow a normal heart rhythm to resume. This device delivers electric shock to the heart in order to allow the normal heart rhythm to resume. To resume means to
continue.
Yeah, to continue, to start again. Good. To be restored. Okay, so to treat here, as you see, the irregular heartbeat or arrhythmia and the sudden cardiac arrest. Here, let's focus on following. Here, I want to explain the meaning of following and allow a normal rhythm to resume following sudden cardiac arrest. Following. Say following an accident, following a cardiac arrest, following an operation.
That occurs due to the cardiac.
Yeah, due to, yeah, or after. Can use also after. After. This device allows the normal heart rhythm after, or which is caused by or due to sudden cardiac arrest. Yeah, the final picture shows you the recovery position. What do you use in French? for the word recovery position?
Position latérale de sécurité.
Yeah, use PLS. Students usually use this word PLS in French, and in English it has a different name. It's called recovery position. Okay, so here it is a safety position. You place the victim in. As you see there in the caption, the hand supports the head, and the knee is, and one knee is bent to stop the body from rolling onto the stomach. Okay, and at the end you have put them in this position to keep the airway clear and to prevent choking. So it is a safety position. You place the victim in, okay, supporting his head by the hand, preventing him from rolling onto his stomach, and keeping the airway clear, and to prevent and preventing choking. Okay. Okay, nice. Here you have a table to complete. Okay, so this table here is composed of 3 columns. Oh, this is column C, is not written. So here, column C. Okay. In column A, you have the medical emergency, which you are going to look for. In column B, you have the way you respond to it, and then the outcome, the result, when you respond this way. So what will be the outcome? Okay. Here you have, so first line, you have induced vomiting, is how you respond to it. And the outcome, you have just the stomach. So there is stomach and there is induced vomiting. What is the medical emergency here? So induce vomiting, it means you provoke it, you cause it, you cause vomiting. You make the victim vomit. You cause him to vomit.
Choking.
For example, by pressing the tongue here, and you make him vomit.
Choking.
What is the emergency here?
Choking.
Choking. You make him vomit. Maybe? I don't know. Okay, so let's skip it. Let's move to the next one. Here you have delivering 5 back blows forcibly between the shoulder blades with the heel of one hand. Here, this is your response to which medical emergency?
Choking.
Cardiac arrest.
Cardiac arrest.
Cardiac arrest. Back blows. Huh?
Choking.
Choking.
Choking. Huh? So you give or you deliver 5 back blows, yeah, to respond to choking. And what is the outcome? The embedded particle. What happens to the embedded particle?
Dislodged.
It's dislodged. Nice. Good. It's dislodged. It's removed. Huh? It's cleared. Nice. Then you have next, you have a flashing with water. Means you cause a large quantity of water, and the result is the embedded particle in the eye. So here the problem here is with the eye. And because of this problem with the eye, you flash water. You flash water. You pour and you cleanse. You cleanse with large quantities of water because of this problem of the eye. What happened to the eye? What do you want to do? There is an embedded particle in the eye. There is a small lodged particle in the eye. So you will remove it. So here the outcome is removing the embedded particle or dislodging the embedded particle or clearing this embedded particle. And the problem here is a foreign body in the eye, then here you have performing artificial respiration. And then you have natural breathing. You perform artificial respiration to respond to which problem?
Breathing cessation.
Breathing cessation.
Cessation, nice. Breathing cessation. Yeah, breathing ceased. You perform artificial respiration, and after you perform artificial respiration, what is your outcome? Natural breathing.
Start the natural breathing.
Yeah, you start natural breathing, or you restore, or you bring back, you restore this natural breathing. So the natural breathing will resume, will start again. Okay. Now here you have the answers. So most of your answers were good, except for the first one, we didn't give the answer. So when you induce vomiting, the noun is induction. There is vomiting induction when there is food poisoning. So you clear the stomach. Choking to clear, dislodge the embedded object. Then clear or dislodge or remove the embedded particle in the eye, restoring or establishing or bringing back the natural breathing, and again the same verbs, re-establishing or bringing back the heart's rhythm. We didn't see this. We didn't come to this, sorry. Yeah, here the problem is cardiac arrest. Yeah, I overlooked it. Of course, the technique is CPR. Or it can be called cardiac massage to re-establish the heart's rhythm. Okay. Next exercise is about how to perform artificial respiration. How to perform it. I think, of course, you learned how to perform it, but now you learn how to perform it in English, using English, without the practice, of course, just the language. Here you have many steps. From 1 to 11. Okay, let's now fill in the blanks, starting with the first letter. It says start artificial respiration and send for medical aid. First step is L, the casualty on back. Casualty is the victim. Casualty is the victim. L, the casualty on back, if possible, on a table or bench. What can be the verb here?
Lay.
Lay, excellent. Then K, or stand by the casualty's head. K here means be on your knees.
Kneel.
Kneel, nice. Then third, see the mouth and throat of O, including broken or displaced dentures, means artificial teeth, by sweeping a finger, mean moving a finger around the inside of the mouth. You sweep or move gently. So sweep here means to move gently. It means to clean. So to sweep means to move your finger around the inside of the mouth here gently. For which purpose? To see the mouth and throat.
Control.
Control.
Clear.
Clear. Yeah. Clear. Clear means actually clear the stomach. Clear the stomach means remove what is in the stomach, and here we remove, we dislodge what is in the mouth. Maybe, I don't know, there is a small object, maybe a chewing gum, maybe any object in the mouth, and you will clear it, remove it with your finger. You clear the mouth and the throat of what? Objects, yeah, or obstructions. Fourth step, open the airway. Open the airway. How?
Head tilt.
Excellent. Head tilt and the chin
Lift.
lift. Good. Head tilt and chin lift. Then you will pinch the casualties and together with your fingers.
Nose.
Nose, yeah. Or what do you call these two holes here?
Nares.
Neris.
Nostrils.
Yeah, nostrils. Excellent. Nostrils. Aren't there men here? No men are attending the lesson. Only ladies. Okay, so pinch the casualty's nostrils together with your fingers to prevent air leakage, so that air doesn't leak. Good. Open the mouth, your mouth wide, and take a deep
Breathe.
breath.
Breath.
Because breathe is the verb, and breath is the noun. Take a deep breath. Excellent, excellent. I'm happy with you. Seal your lips around his or her mouth. Seal, does it mean seal? Seal your mouth or seal your lips. Seal your mouth around his mouth. It means
Cover.
sorry. What is the word? To seal. To seal, it means to close tightly. Okay, so close tightly. No way of air leakage. Huh? So close tightly, seal it. No air leakage, no leakage. So seal your lips around his mouth. Then be forcefully into the victim's mouth until the chest arises.
Blow.
Blow. Yeah, blow forcefully. That means emit this air from your mouth. Blow forcefully to the victim's mouth until the chest arises. So be careful for infants. Huh? Do not blow forcefully. Huh? Be careful. Just blow small puffs of air from your cheeks, small puffs of air. Then remove your mouth and allow the chest to the chest arises. So there is inhalation. Then in exhalation, the chest will
Flatten.
flatten. Why not? Yeah, to flatten or to fall. Can use flatten or fall. Nice. Continue at a rate of 10 breaths. Maybe 10 is not nice. Huh? Of 10 breaths per minute. Maybe 16. Huh? It's better than 10, I think. Huh? So continue at a rate of, say, 16 breaths per minute until normal breathing is, or until medical aid arrives.
Restored.
Restored. Good. Or regained. Or re-established. When the casualty is breathing, if hopefully the victim breathes, so place in which position?
Resting.
Recovery.
No, let's recovery.
Recovery.
Okay, let's remind you of this position. What is it? Okay. Yeah, this position, recovery position. Okay, so place in recovery position or until medical aid arrives. When the casualty, place in recovery position. This prevents on the tongue.
Choking.
Yeah, good. Choking on the tongue and allows the fluids to drain. So here, most of your answers were nice, were good, excellent. So lay or place. Just remember that lay is a regular verb, and the past and simple past, and the past participle, the simple past and past participle laid. So we say the victim is laid on his back. Clear obstructions or obstacles or objects. Tilt and lift. Deeper breath. Explain that the skin is closed tightly or firmly. Blow forcefully. Allow the chest to fall, or you gave the word flatten. Accept it. Restored, regained, re-established, recovery position, and choking. Excellent. Okay. Okay, nice. One more exercise about artificial respiration. Let's do it quickly. It's a gap filling exercise. Okay. Gap filling exercise. Okay, so let's make it clear for you. It shows you, it is similar to the first one, but it's a gap filling exercise. So here you have the words, the missing words. So you have blows, you have flow, you have placed, upward, seizes, shut, tightly, resumes, tilted, and exhalation. Okay. Can any, so just to do it quickly, to save time, can we do it together? Okay, and help one another to give the answers. Any volunteer to read? And the others can help with the answers. Any volunteer to read the paragraph? Hijr Jarraya, for example. Who is Hijr, or what is Hijr Jarraya?
Me.
Hijr Jarraya.
Artificial respiration is any measure that causes air to
in and out of a person's lungs.
flow.
Flow.
Yeah, flow. Yeah, this is artificial respiration is air. You cause air to flow in and out, in and out. So flow in and flow out, flow in and flow out. Inhalation and exhalation, inhalation and exhalation. Letting air in and letting air out. This is what it means, flow in and flow out. So letting air in, letting air out, inspiration, expiration. Good. Yeah, carry on.
Of a person's lungs when natural breathing shut.
Yeah, when natural
Ceases.
breathing
Ceases.
Ceases. Yeah, we use a simple present because here we use it's a general truth. So here we use it's a general truth. When speaking generally, when natural breathing ceases or stops. Yes, please.
As in respiratory paralysis, electric
Paralysis.
shock, electric shock, drowning, choking, gas or smoke inhalation or poisoning. In emergency situations, when no professional help is available, rescuers undertake the mouth-to-mouth or mouth-to-nose method. First, any foreign material is
Swept.
Is swept.
Are you following the screen here? Because I made some change. Do you see swept here or no? Okay. Okay, so it's swept out of the mouth
with the hand. The victim is placed on his back with the head upward.
With the head upward, backward, it can't be. The head
placed backward.
Tilted.
Tilted. Yeah, with the head tilted. So one end is higher than the other, with the head tilted. And to give more explanations, more details, to show the position of the head, the chin is pointing
upward.
Upward. So this is the position of the head. So the head is tilted. And how is it tilted? It's not tilted downward. The head is not, because you can't tilt the head downward. No, the head is tilted backward. To provide more details, with the chin, of course, is upward. Yes, please.
So that the tongue doesn't block the throat. The reviver's mouth is then placed
tightly.
Yeah, it's placed tightly.
Over the victim's mouth or nose, with the victim's nostrils or mouth held
shut.
Yeah, with the victim's nostrils or mouth held shut means closed. No leakage.
The reviver takes a deep breath and blows into the victim's mouth, nose, or both. The reviver stops blowing when the chest expands, turns his
it's a good. That's another verb, expands, because you used here you used earlier we used arises, the chest arises or expands.
Turns his head away and listens for exhalation.
Yeah.
If the victim is an adult, blowing should be vigorous at the rate of about 12 breaths per minute. Breathing into the subject should be continued until natural breathing resumes.
Yeah, resumes, starts again.
Or until the professional help arrives.
Good, nice. So it is easy to do, and you were excellent. maybe because you were excellent students, not because it was an easy exercise. Let's now read all the paragraph quickly without interruptions. Can you read, please, quickly the paragraph? You have Masarra, for example. Masarra, yeah, remember you, Masarra.
Yes.
Happy that you are here. Okay, yes, Masarra, can you read all the paragraph now without interruptions? Quickly.
Okay. Artificial respiration is any measure that causes air to flow in and out of a person's lungs when natural breathing ceases, as in respiratory paralysis, electric shock, drowning, choking, gas or smoke inhalation, or poisoning. In emergency situations, when no professional help is available, rescuers undertake the mouth-to-mouth or mouth-to-nose method. First, any foreign material is swept out of the mouth with the hand. The victim is laid on his back, with the head tilted backwards and chin pointing upwards, so that the tongue doesn't block the throat. The reviver's mouth is then placed tightly sealed over the victim's
placed tightly or sealed, so the same.
Over the victim's mouth or nose, with the victim's nostrils or mouth held shut. The reviver takes a deep breath and blows into the victim's mouth, nose, or both. The reviver stops blowing when the chest expands, turns his head away and listens for exhalation. If the victim is an adult, blowing should be vigorous at the rate about 16 breaths.
16, maybe I corrected that because in the paragraph was 12. Maybe 16 is more accurate. Huh?
Yes, per minute. Breathing into the subject should be continued until natural breathing resumes, starts again, or until the professional help arrives.
Nice, excellent. Okay, you have now the last gap filling exercise. Okay, here maybe exercise should be exercise. This paragraph you're going to see is about how to respond to a rabid dog bite. Here, rabies or hydrophobia. So it explains the contagious and fatal viral disease of dogs and other mammals, transmissible through the saliva to humans and causing madness and convulsions. Okay, now where are the words of the list here? Because the gap filling exercise. Yeah, so this exercise is you have two tasks. Huh? You will put the words in the right form and you will fill in the blanks. Huh? Can you pronounce the words of the list? You read them? Anyone to read the words of the list? No one? Okay, so vaccine. It's not pronounced vaccine, it is vaccine. You have to see, so long sound, vaccine. Dressing. Dressing, just to remind you, the word dressing is the covering. It's a material used to cover the wound. Okay. Severe, mild. Severe and mild. Severe and mild. They are opposites. Huh? Remember, we use these words in this lesson. Huh? Mild and severe. In mild cases, the ligaments overstretch. In severe cases, the ligaments tear. So there are mild cases and severe cases. Then you have thoroughly. Thoroughly, it means completely. Here, just one context of thoroughly. In anatomy, you study the structure of the body thoroughly. Okay, so I mean, you don't miss any details, so thoroughly, thorough study. But in English, you study anatomy, not thoroughly, which means briefly, at a glance, so thoroughly. So we say, wash your hands thoroughly. Okay, so we are recommended these days to fight against the coronavirus. We are recommended to wash our hands regularly and thoroughly, means completely, all the parts of the hand thoroughly. So between the fingers, under the fingernails, the palm, the top of the bottom and the top of the hands, so thoroughly. And then you have promptly. Promptly, do you remember the word? Promptly, say prompt medical assistance. Hijr, what is promptly? When there is a medical emergency, you have to act, and you have to take action promptly.
Fast.
Sorry?
Fast.
Promptly means you have to act promptly. No delay. Promptly. Promptly. Anyone to explain promptly? Act promptly. Immediately. Immediately. Yeah, immediately. Quickly. Yeah, quickly, fast, immediately, promptly. No delay. It's a medical emergency. So all the words now clear: vaccine, dressing, severe and mild, thoroughly, completely, and promptly, which means immediately. I explained these words for you. Okay, so they are explained for you. And the noun here is severity, severe severity. Okay, let's now read this paragraph as we did with the previous one. Okay, so let's have any volunteer. So we'll hear whose voice. We'll listen to whose voice now. Masara again. Okay.
Okay.
Yeah. Okay.
Wild animals, particularly bats, serve as a natural reservoir of rabies, a disease that is almost fatal unless promptly and properly treated.
Excellent. So unless. So this disease is fatal. It is deadly. If it is not, so unless means if it is not promptly and properly treated. So you use here the past participle. Yes, please. Nice.
The virus is present in the saliva of dogs and other mammals. Domestic animals should be immunized against rabies. Rabies is transmitted to humans by an animal bite or through a cut or scratch in the skin. The infected saliva may enter through any opening. Emergency treatment: the area around the wound should be washed thoroughly and repeatedly with soap and water, using sterile gauze. Sterile gauze dressing to wipe fluid away from, not toward the wound.
Yeah.
Another sterile dressing is used to dry the wound, and a third to cover it while the victim is taken to hospital. The patient may have to undergo a series of daily rabies vaccine injections lasting from 14 days for a case of mild exposure to 20 days for severe exposure.
Nice. Okay. So this is the paragraph with corrections. Okay. Okay. So here the first lesson came to an end, which is about medical emergencies and the life-saving procedures. Okay. Now in this half an hour we'll move to the next lesson, please, about the allied healthcare professional care. Allied health professional care. What is this lesson about? Here we will not, or we will speak about the, not about nurses, we'll not speak about nurses, we will not speak about doctors, we'll speak about other workers who are needed by patients. They're not doctors and they're not nurses, they're called allied health professionals. In French, you call them les paramédicaux, these people are needed, okay? We'll see some examples of jobs, okay? Just by the way, you call all of them the doctors, the nurses, and the allied health professionals. So all of the above are called what? For example, these days we thank and we express our thanks and gratitudes for the doctors, nurses, and the allied health professionals for their hard work and sacrifice and fight against the coronavirus. So we thank them. So we cannot thank only doctors and forget about nurses. See, I will thank doctors and I thank nurses and I thank so we thank all of them. So we thank whom? Or our thanks for whom? What do you call them? Any answer? Okay, so it doesn't want to unveil here. You have a problem with this selection here. Yeah, they are there. So we call them. It's a problem here. So one more try. So no problem, it's not waste time. So we call them healthcare workers or healthcare professionals or healthcare providers or healthcare givers. So our thanks for the healthcare workers. So we need all these people. This is because patient care requires a wide range of people as any strong team to complement one another, okay? So who are these people? The first profession, the first health profession or the health professional is, as you see in the diagram here, or in this picture here. This picture shows you an allied health professional who is needed in patient care. He's not a doctor, he's not a nurse, but he is a, his work is, sorry, he's a
paramedic. Paramedic,
excellent. He's a paramedic, or you can call him EMT. Maybe the person who is less qualified is EMT or emergency medical technician. Good, so he's a paramedic. This is a paramedic. The paramedic here, let's just read here to save time here. In an emergency, the paramedics use high-tech equipment. So they use these equipment such as defibrillators, intravenous drips to administer the drugs, ventilators to supply oxygen, and they also treat someone who has fallen, so someone with, for example, who has fractures. So before reaching the hospital, they treat him before the doctor comes and treat the fracture, or they can treat a suspected stroke before reaching the hospital. After the paramedic, so as you see here, who is he here? You see here a healthcare worker examining the patient's foot. What do you call the allied health professional who treats people's feet? He's concerned just with feet and problems of the feet. Do you know the word in French, for example? Okay, so he is Podiatrist or chiropodist. Podiatrist is American and chiropodist is British, and the job here is to treat the people's feet. Here, let's take a look. So you have here a worker here designing, and designing what? I hear no voices. A worker here designing an artificial limb, this artificial limb here, you can call it a prosthesis. As you say, prothèse in French, it is prosthesis. So his job is to design and to make and to fix the prosthesis. The prosthesis is the artificial part of the body, and the plural is a prosthesis, and the person here is called a prosthetist. So here is a prosthetist. Okay, so here next you have another picture showing here a worker fitting what in the patient's leg here. What is he fitting? What is he fixing? What is he fitting? Is it the fit?
No disease.
He's fitting what? You forgot maybe the word here. Okay, so the patient here is wearing a leg splint. So here, and the worker is fixing this leg splint, and this leg splint is an orthosis. It's called an orthosis because you have many orthoses, not just the splint. Because you can have, for example, the neck brace. The neck brace is an orthosis, and the leg splint is an orthosis. This is written there, the orthosis, and the plural is orthoses. And the question is, who designs and makes and fits and attaches these appliances or devices? The answer is the orthotist. We have the prosthetist and the orthotist. The orthotist makes orthoses, artificial replacements, and the orthotist designs and fits these appliances. The question is here, these orthoses here, either the braces, for example, the neck braces and the leg splints, they function in what? What is their function? What do they function in? You have any answer? Why are some people recommended to wear these orthoses, either splints or braces? We can have other names. Huh? No answer? No idea?
To reduce pain?
Good, excellent. So one reason is to reduce pain. Excellent. Another reason?
Correct deformities.
Yeah, good. So we have the answer. So to correct deformity. Yeah, to correct deformity. For example, the legs or the feet are deformed. Okay, so you will correct deformity. Okay, you will restore the good shape. Okay, restore the good shape or the healthy shape. So you wear an orthosis, or they can be recommended to be worn after, for example, fractures. After fractures, they said to aid rehabilitation, means rééducation, to aid rehabilitation, so to assist the mobility, because the arm, for example, was not working because of the fracture and the cast. So this orthosis will aid mobility, and the orthosis can be worn to restrict mobility. Yeah? For example, when you wear the brace here to restrict mobility. So we have a variety of reasons. They are there. So they aid rehabilitation from fractures after the removal of a cast by providing mobility, or they can restrict mobility, and they can reduce pain, as you said, and they can also correct deformity. Here in deformity, I have the example of clubfoot. So as you see here, the picture showing the clubfoot. Clubfoot. So here the foot is deformed, is mal shaped, is badly shaped, and the child or the baby wears an orthosis to correct this deformity. Nice. Time is running. Another allied health professional. Who is he? Who is she? She here. Who is she? Here, it's a radiographer, diagnosing radiographer, or just a radiographer, okay? And these radiographers use a range of imaging technologies, but imaging, like these techniques like X-ray, MRI, and ultrasound. Okay, so they're radiographers. Who is he? He works in the laboratory. Laboratory is British and laboratory is American. So laboratory, American, laboratory is British. This man is working in the laboratory. He has test tubes. This test tube is, I think, is filled with blood. What is he doing? He has also a microscope. He is sorry.
Analysis.
Now, yeah, he's performing analyses. Analysis is plural because he performs just. It doesn't perform just one analysis. It performs a number of analyses during the day. So analyses or tests. So this is his main job, is to perform tests, to perform analyses, for which purpose, of course, is to screen for diseases, to screen for, screening, maybe the word in French is the word dépistage, so screening, so to screen for diseases. So here you have the name of the job. The person here is a medical laboratory scientist or a medical technologist. So medical laboratory scientist or medical technologist. He performs analyses and tests on fluids such as urine, sputum, stool, feces, etc., synovial fluid, and other specimens or samples. Good. The last picture is about here, this swimming pool. Okay. Of course, here they are not swimming for pleasure. Here you have patients in the pool. There must be patients, of course. They are in the pool, and who is with them? Who must be with them? Because they are in the pool, not for pleasure, but for therapy. Okay, they are having therapy. Maybe because they are there because they have back pain, because they have spine pain. Maybe they are there following an operation. So for rehabilitation, they are there to restore mobility of their muscles or to strengthen their muscles. That's why they are in the pool. Okay, so maybe they are there for fitness. Maybe one of them is, maybe they are obese. So for fitness, they do exercises. So here they are doing exercises in the pool for a variety of reasons. Who must be with them? Who must be with them to show them the exercises they need to do? They can't be left alone, of course, doing any exercises they can do. There must be someone, a therapist. So a therapist must be with them to give them the specific therapy for the specific problem, for the specific health problem. So here the person is called an aquatic therapist. Okay, and this is about aquatic therapy or water therapy. Okay, so here they are having, what are they having in their hands here? They're having they're called barbells. Barbells here, they are lifting the barbells here to strengthen their muscles. So we have a variety and a number of exercises that can be done in the pool. Okay. Okay, now here you have situations, and you will identify who the allied professional here is. So patients need a professional to administer and monitor anesthesia. Yeah, good. Anesthesia technician to administer and monitor anesthesia. And after injury or a chronic illness, patients need a worker to help them exercising after injury, after fractures, after sprain, after strain. Sorry?
Therapist.
Yeah, physical therapist or physiotherapist. And it can be also in water. Aquatic therapist. Huh? So if the exercises are done in water, so he or she needs an aquatic therapist. Outside of water, so she will be a physiotherapist or a physical therapist to aid rehabilitation and strengthen the muscles. You need exercises. Third, in the pre-hospital environment, victims need a healthcare provider trained to respond quickly to emergency situations. He or she assesses means to evaluates the patient's condition and makes life-saving decisions and techniques. So about decisions, it must be decisions, and makes life-saving decisions about whether the patient can be treated at the scene or transferred to hospital.
Paramedic?
Excellent, paramedic or EMT. Yeah? Losing a body part through trauma, disease, or congenital conditions, patients need an artificial device that replaces the missing one, like a prosthetic leg.
Prosthesis.
Excellent. So E, answer E, which is here, prosthetist. Nice. 5, in the operating room now, we are in the operating room. The surgeon needs a technician to be with him at every step he takes to complete the surgical procedure. Is there an answer there?
A surgical technologist?
Yeah, surgical technologist. So in French, we use the word instrumentiste, but here we have surgical technologist or surgical technician. Huh? We are now in 6. Huh? We need a professional now to advise us on nutrition-related matters. Is the answer there?
A nutritionist?
Yeah, yeah, good. Nutritionist, huh? Or dietitian. Dietitian is concerned with the diet, with the nutrition. So now 7, huh? 7. A technologist now or a technician is needed to perform imaging here of the human body for diagnosis.
Radiographer.
Radiographers, good. Or you can call them also radiologic technologists. 7 situations only, okay? Okay, now this one can be left for you to do at home. I will provide you with the answers. Now let's here finish with this table. Okay, it's about for the word formation. Here you have the noun. I gave you the noun referring to the specialty, and you will give me the noun referring to the person and some adjectives. When I say therapy here, it's not a specialty, but here it's noun for thing. So therapy. The person. Therapist, good, therapist. Who provides therapy is a therapist. We have the physiotherapist, the aquatic therapist. And the adjective is therapeutic. Maybe you don't know the word, therapeutic. Therapeutic benefit, we say, therapeutic purpose, therapeutic. Profession, the person is a professional. means a worker. Professional is a worker. Okay, so our lesson here is about the allied health care professionals. So the paramedic, the prosthetist, the radiographers, all of them are workers, so they are professionals. Now prosthetics is the branch that deals with prostheses. It's called prosthetics. The person is who makes, designs and fits artificial parts of the body. He's called prosthetist, right? Prosthetic, the adjective, then podiatry. Podiatry, here the branch that deals with the problem of people's feet. So the person is a podiatrist, or chiropodist, but here podiatrist because you have podiatry, and the adjective podiatric is different, pronunciation is different. Here are the answers. So you have therapist, therapeutic, professional, prosthetist, prosthetic, podiatrist. Okay, so we have come, or the lesson has come to an end now. So happy to be with you for these 2 hours. Really, I'm happy. Sincerely, I'm happy to listen to your voices, to be with you. Okay, I hope to see you soon. Okay, after the confinement is lifted. Okay, so thank you for your attendance and thank you for your participation. Here I will provide you with my email address. Maybe we need some, you ask some questions, you need some help. So I will be there to respond to your questions. Okay, I hope to see you as soon as possible.
Thank you.
Goodbye.
Thank you.
Tell me goodbye.
Thank you, teacher. Goodbye.
Thank you.
Thank you.
Thank you.